Hey, this is Dr. Joe Tanti. In today's episode, I'm talking with Dr. Sarah Kjos over in Camrose at Martinson Health. In today's episode, we're talking about her practice, the way she practices, and the people she helps with pregnant women and sports and athletes. So, if you're interested in any of that and you're in need of chiropractor in the Camrose area, you're going to want to check this out. At the start of our interview, I for some reason keep saying Madison Health, although I know she was at Martinson Health. I just couldn't get the correct words out. So hopefully that's not too confusing for you. Anyways, hope you enjoy the show and I'll talk to you soon. All right. Hi there. Welcome to Building a Healthier Edmonton podcast. I'm Dr. Joe Tanti. I'm here with my special guest, Dr. Sarah Kjos, and she's a chiropractor over in Camrose at Madison Health. She specializes, and we're going to talk about all this in just a moment here, but her special interest is on helping pregnant women, children, and also athletes getting back to their game. So welcome to the show, Sarah.
Yeah, thanks, Joe.
Yeah,
Good to be here.
great. So let's just start. What brought you into becoming a chiropractor to begin with?
Yeah, well, originally it was sports. I kind of spread myself a little bit too thin in high school and I had terrible shin splints. And I didn't really have time off during the year from athletics. And so got kind of past the abilities of our athletic trainer in school at the time. He referred me out to a chiropractor. Sure enough, results were amazing. And I just absolutely loved going. It's one of those things where I looked forward to it every time I'd go. Was such a profound effect. I was able to compete to my best ability again, whereas previously I couldn't. Years later, then I start looking into a career path. I had a couple close family friends who are also chiropractors. Spoke with them a little bit more in detail. And the way they spoke about their jobs was unlike anyone I've ever heard talk about their job before, right? They were so in love with being a chiropractor. So I looked more into it and found there are so many different avenues and just really sparked my interest. And I've been loving it so far.
That's great. How long have you been practicing for?
Graduated in 2016, so still in my first 5 years.
Okay, that's the same as me.
Oh, brilliant.
Yes, and you went to Portland, you said, right?
Correct, UWS. Oh, before I forget, it's Martinson Health.
Martinson Health. Okay, sorry about that.
No,
What
you're so close.
I said Madison.
Yeah, so close.
Okay, and so tell me a little bit about. That's not a usual first experience with a chiropractor. A lot of people say chiropractor, oh, I have a back or a neck issue, but you had shin
Yeah,
splints of all things.
yeah, so random. Yeah, so that's kind of what opened the doors, realizing they could help with sport injuries. And it was like a sports specific chiropractic clinic. But while I was there, she kind of, discussed a little bit more about what they do and look a little bit at the spine. So I think it was so long ago, but if I remember right, she would adjust my thoracics and yeah, do a couple modalities on my shins, give me exercises, and it was so much fun.
Right, that's great. And
Mhm.
how did so you played professional volleyball, right? Tell us a little
Correct.
bit about your career with that.
Yeah, I mean, yeah, it wasn't that exciting. It sounds a lot better than it actually was. So yeah, I played throughout high school, played 4 years in university, but then I just kind of not so much retired, but retired from playing high competitively or that high level. Just played recreationally for a couple years and through chiropractic school, just recreationally. But after school, I got married to Paul Kjos, who was also a grad from UWS, another chiropractor. And he actually did previously play professionally in Europe, professionally,
Oh,
which is pretty neat. So kind of making me realize oh, this is a real thing. So we got married and we're like, you know what? Let's take this opportunity to travel. And so we found a place where we could both practice and play volleyball at the same time. Now, our search was really narrowed because in order to work as a chiropractor in another country, you have to speak the language. We both only speak English. So there's really only a couple countries we could choose from. And England has a fairly okay league. I'll say it's a great stepping stone type league, whereas graduates from university would go play in England while they're searching for a contract in mainland Europe, or vice versa. If they finish playing like their career professionally in mainland Europe, which is just that next level, then they might like finish off playing in England for a couple of years and then, retire for real. So moved to England. We were northeast in Newcastle, about an hour and a half train ride south of Edinburgh, Scotland, which is amazing. Anyways, moved over there. We both just kind of walked on, or like we spoke with the coach, gave him our background. He's like, yeah, come to a practice. Let's see how it goes. And yeah, it went really well for both of us. Anyways, yeah, I started practicing right away. Got on the teams and started traveling around England and Scotland playing.
That's
And
great.
yeah, and practicing at the same time, which is so much fun. But anyways, played over there for 3 years. Had my daughter in the second season, which was fine. Second season, and then my final season, I played with the baby, as in like I would have to wheel her in the pram and like put her on the side of the court. We'd play. I would like feed her in between sessions and whatever. Travel with her. It was so much fun. What a fun way to end. But anyways, season got cut short because of COVID, of course, but we did make it to the national final. The final was the one match that got canceled.
Oh, so you're this close to winning it all. That's unfortunate, but yeah, diseases trump sporting events for sure. So that's what prompted you to come back to. You said your husband was from here, so that's what prompted you, I'm assuming, to come back to to Alberta.
Yeah, we discussed it before, like where do we want to go next? And we do want more kids as well. And I should mention, I'm like 27 weeks pregnant at the moment as well.
Oh, congratulations.
Yeah, thank you. So finishing off having kids in Canada just seems like such a nice place to raise kids and have kids as well. Take advantage of that healthcare, right? Especially since I'm from the States. And so it's like a huge difference.
Right.
But yeah, discussed it beforehand and thought, yeah, Alberta is the way to go, especially being around family.
Okay. So fast forwarding just a few months now, or not really, just kind of the natural progression there. It sounds like, I'm assuming, because you had the children, you've been through the pregnancy process, you're pregnant with number two. That's probably drawn a lot of your interest to the pregnancy world and kind of opened your eyes to what's out there.
100%. Even when I was in school, like, yeah, chiropractic care for pregnancy and babies like was cool, but I honestly had zero interest in it whatsoever. I was just all about wanting to work with athletes just because that was much more my background and that's what I was familiar with. Anyways, yeah, graduated, actually had a baby, and then realized chiropractic care during pregnancy was amazing. Obviously, working in a chiropractic clinic with other chiropractors, I was getting, weekly treatments, and every 2 weeks I would get a massage. Like I was really good about taking care of myself. Just how amazing it was. And then being pregnant, caring for pregnant women, you like get that special connection. And then just doing more, continuing education about it and just realizing how much of a profound effect you can make. So it's not like I have so much fun getting treated while pregnant, but then being in the other side of it as well, I feel like we can just build such a good connection. And so now, I mean, same thing, pregnant again, treating pregnant women, getting that connection, being able to really help each other it's just so much fun.
Right. You're not only trying to be empathetic, because you're living, you're going through that yourself as well. What are some, what are some common like misconceptions people may have, or that are a little nervous about trying chiropractic while they're pregnant? Sometimes they may think it could be dangerous or, harm the baby or harm themselves.
Right. Yeah. That's a great question. I think it's more so people who may not be as familiar with chiropractic care or may just not realize there are so many different techniques that you can use. Similar to treating kids and babies, right? Like we're not going for cavitations here. We're just, searching for little things, and techniques are so much different. Anyways, I'll kind of go on to like specific techniques like during pregnancy that people may not be as familiar with, or chiropractors obviously are, but like general public maybe not so
Sure.
much.
Yeah.
So I am Webster certified, and that's like usually what I go for when treating pregnant women. or honestly, lower back and pelvic pain in general. I use it a lot. And it's had given me really good success. So I really enjoy using Webster technique. But yeah, just how there are techniques specific out there for balancing, aligning the pelvis, and basically giving baby the most around a room, which makes mom so much more comfortable. Yeah, so it's not about twisting lower backs during pregnancy, it's about balancing and making sure things are moving the way they should. And it helps, especially like for months, your body's growing so rapidly, changing so rapidly. So I wanted to keep up with those changes and how things are pulling differently. I don't know if that really answers your question, but
Sure. So what do you mean by, again, I know, but people that listening or watching, they have no idea what these name techniques are. What kind of, can you kind of walk through the process of like, what is Webster technique? How is that different than, possibly twisting someone and like jumping on them and trying to get a bunch of popping noises and, that, because that can oftentimes be very uncomfortable, especially through the ribs. And I find with any pregnant woman, any discomfort in through the abdomen or in through the ribs, it's just not going to be good. And it's so easy to aggravate things because, like you mentioned, their weight is changing, they're growing forwards, they're growing sideways, their hormone levels are all over the place, so the joints
Mhm.
are slack, the muscles are changing as well. So there's a lot of stuff is happening in a certain period of time.
Yes, exactly. Yeah, good question. So this is, I'm wording it for like patients, correct? So like I'll describe Webster technique, just a fancy name developed by a guy named Webster, but it's really focused on the pelvis. So the way that I always like to check, so I always like to start with leg length. Now I like to check leg length first because sometimes it can show if there's a tilt in the pelvis. I like to check. Now, if one side does feel a little bit stuck, now I will go ahead and check mostly the sacrum. I focus a little bit more so on the sacrum, which is the triangular bone at the very, very bottom of your spine. So if you feel like your tailbone's at, it's the connection to the tailbone there. So I like to kind of feel around for that spot. And then I'll be checking the sacrum and things around it. So in order to adjust the sacrum, again, that triangular bone at the bottom there, I like to use the drop table. And that's where a piece in the table pops up. When I push, it drops back down. It's a really nice, gentle, yet effective technique to help to move the pelvis. After I do that, and once I feel things are balancing out a little bit more, I check the glutes, which are the bum muscles. So loosening off those muscles. Now I will use a bit of pressure, but it's always to the mom's comfort level. I'll never go beyond what's comfortable. Loosen off glute muscles there, and then I like to check a ligament that connects the sit bone to the tailbone. Loosening off those, so basically checking all around the pelvis again. Then personally, I'll go through, adjust the rest of the spine. Some people do, some people don't, depending on what people want. I like to check full spine. People turn over onto the backs, and then I'll be checking the pubic bone next. Because thinking the pelvis, right? I just checked everything on the back of the pelvis. Now I want to check the front of the pelvis as well. Everything's connected there. Loosen off the pelvic bone a little bit, pubic bone a little bit. Now those that don't move a ton and also are not very comfortable. So we're only in that spot for maybe 5 to 10 seconds, again, depending on what we find and depending on mom's comfort level. From there, I'll be checking the psoas muscle. Now, some people may have heard of this muscle, some may have not, but it's a muscle that connects from your mid-lower back and goes out towards your hips and pelvis and connects towards your pelvis, or into the pelvis, excuse me. So then I'll go ahead and loosen off one of those or both again, depending on what we find. And then last, I'll be checking the round ligaments. Now, I did have a patient the other day who was so funny. She was exactly the same like length as me as far as how far along we are in pregnancy. And sure enough, she's like, "Oh, I keep getting lightning crotch, pain." Which is funny. I've never heard of this before. Anyways, of course, round ligament pain. But if you're any pregnant women out there, you get lightning crotch pain. It's usually from the round ligament. It's a ligament that connects from your uterus right towards your pelvis. And you can get that sharp, sharp pain like if you're sitting for a long period of time and then you stand, or it happens a lot of times at night in bed. Like say you're on your back, or excuse me, laying on your side, knees tucked in a fetal position, and you go to turn over, straighten your legs, gets you like that. So loosening up those, and then I'll usually give an exercise or a stretch that can just help them stay comfortable throughout pregnancy.
Yeah, lightning crotch is no joke. I've never experienced it, thankfully. I'm glad about that. But yeah, it can be very, very debilitating and painful, obviously. Yeah, so the round ligament and oftentimes that pubic bone just becomes inflamed too, and it can send, as the name implies, bolts of lightning. Feels like shooting
It's
from your crotch and
real.
down your leg.
Oh my God. Exactly. It's terrible.
Yeah, it's not fun at all. What are some other type of presentations that you see in pregnant women that are quite common? And a lot of the time I'll have some patients or people I know. My wife, we have a son, he's about 20 months, and so when she was in her mom's group, and they would get a lot of doctor's appointments, and they're talking about different things, and a lot of the time they'll see people and they just say, oh, you're in discomfort or pain and you just have to live with it, and suck it up, mom. Which is not very helpful. So
No.
what are some things that you find that can oftentimes be helped with, that people just think that they have to suck it up for 9 months, and then sometimes they have these problems even lasting after pregnancy?
Yeah, a common one we see is sciatica, or like that sciatic type pain. Now for people who haven't heard of that, it's usually like a lightning type pain that goes right down your bum, sometimes all the way down the back of your leg, usually. We see that a lot in pregnancy. So that's something that is really common in pregnancy, but we can help with. Now, it's one of those things that might continue to come back because our body is consistently changing. So that's why it's so important to stay on top of it. Body's growing, make sure you get treated, slash, make sure you're stretching, taking care of yourself so that your body can accommodate, your growing self. That's something. And then something that I see so much with postpartum moms, especially early postpartum moms, is like upper back and shoulder pain and like lower neck pain. And it's always, let's see your positioning for breastfeeding, slash, are you breastfeeding? Thinking positions, even just holding a baby, right? We're chin tucked, looking straight down all the time for hours every single day. So that's something, again, you don't just have to get this pain because you now are looking down at your baby all the time. It's something that we can help with, loosen off, and give you stretches and exercises that you can do on your own to help with this as well.
Yeah, that's great. So common, right? They're always holding the baby because they can't take their eyes off of it or
Yeah.
off of him or her. Just a bundle of joy. And sometimes I noticed when Everett was younger, we're holding him and carrying him, and he usually would favor one position. So
Yeah.
get him whatever position's comfortable for them, and then they fall asleep on you, and then you're sleeping in these awkward positions.
And then you're nap trapped, right? And you realize
Yes.
one shoulder's tucked up, like one leg's at this weird
Yes.
angle, and you're stuck there for like an hour.
Yeah, you don't dare move.
Yeah.
Absolutely. What are some general guidelines in terms of exercise and getting active and doing things when you're during pregnancy? This is assuming a healthy pregnancy. You haven't been told by your medical doctor there's no you're not high risk, you're not eclamptic or anything like that.
Mhm.
It's a normal healthy pregnancy. What are some suggestions or tips you have for people just to try to feel the best that they can throughout the pregnancy and for the development of their baby?
Brilliant. That's such a good question. Yeah, a lot of people hear when you're pregnant, stop doing anything. Not supposed to lift, not supposed to exert yourself. That is completely wrong. So during pregnancy is a great time to think of it as training for the big event, right? You're going to train to be a mom. Now, training in the sense of you want to keep yourself really fit and healthy. So if you're used to being really athletic, if you're used to lifting weights, continue lifting weights. You may have to modify how you're lifting. You may not want to be doing some of these crazy things, but if your body is used to doing something, continue to do it. So back to weightlifting, if you do that, you're not going to continue to increase your weight. You're not going to want to increase how much you can lift during pregnancy. You'll probably back off on how much you're lifting, but you can continue to do the same lifts as long as it's comfortable for you. Same thing with running. If you're a runner, keep running as long as it's comfortable. You're not going to want to increase how long you can run, or you don't want to increase how fast you can run a certain distance. You just want to keep doing the same activities that you're comfortable with. And that is so, so important. Just keep doing what you're comfortable with. Now, if there's someone who does not actually exercise or is not used to exercising before pregnancy, you are still okay to exercise. It's just about doing gentle exercise, listening to your body very well. If anything becomes uncomfortable, you stop. But yeah, just staying active is going to help build those muscles to keep you strong throughout, the process of your body changing as well. So important.
Absolutely. I think there's some recent-ish guidelines, like 2018, there was a massive review. And I think it's similar for pregnancy as well as just general population. You want to get at least, I think it was 180 hours of mild to moderate exercise a week.
Yes.
So that's going to be about 3 hours a week. And that's kind of baseline.
Right?
Yeah.
Which is way more than what most people do.
Yeah, unfortunately. But that's one reason we have so many, health issues and back pain, neck pain, and other health issues as well. So it's important. Yeah, so important to be active for sure.
Oh, follow up on that. Actually, if there's any pregnant women listening, if the pools are opening, swimming during third trimester is so nice. Getting in the pool takes so much pressure off the belly and back. Oh, it's amazing to swim during pregnancy.
Yeah, the buoyancy probably, right? Just helps take a lot of pressure off.
Yes. Feeling weightless again is incredible.
Right. Are there any devices out there have you seen that's like, I'm just thought of this now, like a portable pool possibly, just so you're constantly walking in a pool just to help support the stomach?
Can you imagine? That'd be so nice.
Yeah.
I know, portable pool. The only thing, no, I guess something that's nice to support the stomach, and I do need to look more into this actually, are like belly belts or belly bands. So that's not something I'm super familiar with, which I do need to look more into. I usually just like do athletic tape, but that is something that can help to support the belly for pregnancy as well.
Yeah, I found those to be, I haven't used those specifically, but I've had some patients who have used them. And the taping can oftentimes, as silly as it sounds, it can be helpful. It just feels like it takes like a huge load of pressure off, especially the front of the pelvis, like that pubic bone.
Exactly.
That just gives a little bit of relief. So I'm just thinking here.
Totally. I feel like this is good so far.
Yeah, this is where the post edits come in very handy. So
totally. I feel like I've been rambling a little bit, but
no, it's great. Yeah, I'm enjoying it. This is great.
Good. Your questions are awesome.
Oh, good. Thank you. What have you? Oh, I just totally lost it here.
No worries. Take your time. Especially if we just like edit out this one chunk, it's going to be so much easier than if we have something good and then pause again.
Yeah, exactly. Is there anything that you want to talk about?
We could touch on kids a little bit if you want. I know sometimes it's like iffy.
Tell you what, I got this. And I got 3 more questions, and then we'll probably wrap up. Okay.
Cool.
Okay. So when you have a pregnant person and a pregnant mom and they just come in, they don't have necessarily any symptoms. They have some, some classic things, maybe some discomfort, and they're just more coming in for like a health check. Do you have usually a recommendation on terms of follow-up, similar to an OB/GYN? They follow up the first trimester, they're seeing them a couple times, again, assuming everything is healthy. And then the second trimester, you're seeing them a little more often. And then by the third trimester, coming close to that due date, they're seeing, you're going in very often because that's when things are just rapidly moving and everything's changing. Do you have any type of recommendations that you suggest to people? Something along those lines?
Like a schedule?
Yeah.
Yeah. So I have my personal favorite recommended treatment schedule during pregnancy. And this is, if someone comes in, no real complaints, just want to stay on top of things during pregnancy, as I say, every 2 weeks. every 2 weeks until we hit that 34 to 36-ish week mark, depending on how they feel. Then we go to weekly until baby comes. And that's, of course, if everything we find has been healthy and great the whole time. But I always leave it up for discussion. Like, it's always, of course, their choice. That's just always my recommendation for schedule during pregnancy.
That's probably a personal preference. I'm assuming you discovered that was helpful for you, I'm assuming.
Personally, I mean, I was really lucky in the sense that I worked with other chiropractors. I was getting treated religiously every single week, sometimes twice, depending. I mean, I was playing volleyball as well. So depending on how volleyball
Right.
practice went, or like how the lift went, because I was still lifting. So I was going a lot more frequently, but just at the pace that people are growing and changing, and like the hormonal changes, just everything, I personally like the 2 week schedule. But yeah, it's more often than what some people like, and that's totally up to them. They can choose whatever they'd like, really.
Right. So it's kind of like a personal preference. Some people find it really helpful, and then sometimes they might need to come in more frequently or not as frequently, depending on how they're feeling. Because every pregnancy it's a little cliche, but every pregnancy is completely different. I'm sure you've talked to people, they'll have, multiple pregnancies, multiple children, and they say each one was different.
Yes.
Child A was my favorite because I had the least problems. And then, the last one, or the middle child, was, their problem during pregnancy that was the most difficult. And
Of course.
coincidentally, they're the most difficult child as well,
Right.
possibly.
Of course. Yeah, but you're exactly right. Every pregnancy, every woman's different. So that's kind of the baseline. And then we modify depending on how she's presenting.
Yeah, that makes total sense. Now, after a baby has come
Mhm.
and you have a newborn, is there any suggestions you have on treating the infants or children? Is there any, like, a lot of time people think, they come in and they're an adult and you'll treat them, and for some reason they may think that you're going to do very similar things to a baby, which is a little ludicrous. But what would be your feedback on that?
Yeah, for sure. That's such a good question. So this is one of those things where even in school, I was like, what? Like, babies don't need chiropractic care. But then, yeah, as I learn more about it, and then of course go through the experience myself, of course they do. I mean, think about the actual birth experience, or like even just being in a woman's uterus for 9 months, especially during that third trimester where they're just like stuffed in a funny position for however long. Now, of course, their bones are not ossified yet. And so everything is so much different. Now, I don't usually say, "Hey, when you have the baby, bring them in." It's always a complete, like, their choice. If they have questions about how would you treat a baby, like, I answer that and say, if you feel comfortable or if you notice these certain things, that would be a good time to bring in the baby. I don't want to push it on anyone just because it is, your child.
Right.
um, but so an assessment for a baby, I mostly am looking at developmental reflexes, and a lot of it is observation. And then I do like to check inside the mouth and the skull just for, positioning of proper things, looking for innate tongue ties, lip ties, just in relation to feeding, seeing how feeding's going. Yeah, again, a lot of development and a lot of reflexes. Now, I will say a lot of parents come in with like, oh, my baby has reflux. And that's something where I say I don't necessarily treat the reflex, but I will look at development, reflexes, and physical structure and function. And sometimes helping things like that may help with things like reflux, but I don't say, come in, bring your baby with reflux. Um, I always check these things, and sometimes it can help with other things that a mom might bring a baby in with. But as far as treatment goes, so that's the assessment. And as far as treatment goes, now pressure that you use is basically the same amount of pressure if you're going to touch your eye or check the ripeness of a tomato. Very, very gentle. You can do it in multiple positions. Every once in a while, there's a baby that just isn't really into treatment, doesn't like me touching them, or just plainly wants to be cuddled. So, okay, mom or dad, go ahead and cuddle baby, and I can check their spine while they're cuddling on you. At least they're mid back anyway, easy enough to check in mid back while they're cuddling on mom. Um, Feeling, usually babies are really easy to feel, feeling right through that baby fat. And if there's a spot that's just not moving very well, or it feels yeah, mostly just not moving as well as it should, you just hold pressure. Usually I hold pressure between 5 to 10 seconds, again, that very gentle pressure until I feel things release. And we can do that full spine really, super gentle the entire time. Just gentle holds, really. It's all about feeling. And before I forget, a lot of people aren't familiar with or are familiar with the activator or the clicker for any lay people out there. The clicker can be used for kids, but not babies.
One of these.
If anyone's listening, we got to watch for, yeah, for how much pressure the actual activator is putting out there. The amount of pressure, even on the lowest setting, is more than what you should be using for an infant. I need to look at the actual chart again, but better to use your hands than the activator on babies.
Okay, yeah, and you can kind of target, I feel, specific areas and actually feel what's happening by using your hands.
Oh no, it's cutting out.
Okay, yeah, sorry, I'm just going to cut out here for a second, okay? Sorry,
Okay.
sorry about that. Hopefully that works. So yeah, I find using the hands is you can kind of feel more what's happening, just get that feedback versus using an instrument.
Yes.
I like to kind of use the analogy sometimes is, baby can't tell you what's happening to them. They all they know is something they don't like, they cry. So,
Yeah.
and sometimes that'll come up in different ways. They'll have reflux or they'll have like colic. Colic is kind of this garbage bag term we'll use to describe kids are crying a lot.
Yep.
So it's like, well, it's not helpful.
Yeah. Oh yeah. Also, before I forget too, something that I do like to tell parents, like if they're wondering, like, oh, when should I bring my kid in? Or like, what are things I should look for breastfeeding moms, if they're more comfortable feeding on one side as opposed to the other, or if you find they're sitting or laying down constantly looking towards one direction or one direction a lot more than the other direction. Those are really good reasons to bring them in.
Yeah, absolutely. I think I read some research. I don't know how well, I didn't read it extremely thoroughly, but they kind of came up with a number about 30% of kids usually need a little bit of therapy or some type of rehab. So it's not a lot, but it's always a good idea, I think, to at least get them examined. I mean, you go to see the pediatrician, right? Just to make sure everything is doing well periodically. I don't see any reason why not to bring them to the chiropractor just to make sure everything's doing well.
Yeah, just for a little check. Totally.
Yeah. Yeah. And usually kids respond like extremely quick too, right?
So fast. And I always like to tell the parents as well, like, okay, once they leave, babies usually have a really good feed and or a really good sleep after treatment. And almost every time they'll come back and be like, it was amazing.
Yeah.
They slept however long.
And a really good bowel movement too often. So
Yes.
yeah,
Sometimes during treatment, which is a little funny.
right. Make sure the diaper's on and
Yeah.
we'll get a mess. That's for sure. Great. Well, thanks for your time, Dr. Kjos. Is there anything that we didn't ask or that you'd like to comment or anything else you'd like to say?
I think that was pretty thorough. Yeah, my pleasure. I think we hit all the good stuff there.
Yeah. Well, thanks so much for your time today. All right. Well, this has been Dr. Joe Tanti with Dr. Sarah Kjos down at Martinson Health out in Cochrane. So if you're in the area and you need a great chiropractor, go look her up. Is there anywhere that, Dr. Kjos, is there anywhere that people can connect with you or see what you're doing? Anywhere we can direct them to?
Yes. Yeah. A great spot is just Martinson Health and Athletics Facebook or website. And it is in Camrose, Alberta, just about 45 minutes south of Edmonton. But their website is pretty good. They're great at social media, a lot better than me anyway. I'll have my personal Facebook, Sarah T. Kjos DC, just Facebook. But honestly, I'm not very good about keeping up with it at all. So the Martinson Health and Athletics Facebook is much better up to date.
All right. Well, thank you for your time, everyone. And you can check in next time. Bye.